Atrial fibrillation's fear factor. Atrial fibrillation can be managed with drugs or surgery, but the threat of new episodes of the condition is always there. Taking a normal vacation seemed out of the question once J. Teresi was diagnosed with the heart condition atrial fibrillation at age 24. Teresi began to keep a list of area hospitals wherever he went, and hiking, which he used to enjoy, wasn't an option anymore. It wasn't a cool way to live, says Teresi. You're battling anxiety all the time. You're constantly living with the real threat that you could go into a fib at any time. Atrial fibrillation, or a fib, is an irregular heartbeat that occurs when the heart's upper chambers beat out of sync with the lower chambers. The most common symptoms are palpitations and a rapid heartbeat, says J. David Burkhart, MD, an electrophysiologist at the Texas Cardiac Arrhythmia Institute of St. David's Medical Center in Austin. You're short of breath all the time. You can't do the level of activity you normally could. As Francis Wolf, MD, a cardiologist at Aurora Baycare Medical Center in Two Rivers, Wisconsin, points out, many patients are asymptomatic until a doctor examines them, sometimes for a different condition. Teresi, now 40, recalls that his first AFib episode in his 20s felt like being punched in the chest. He was told at the time that he had holiday heart syndrome, a temporary cardiac rhythm disorder triggered by binge drinking or stress. 2 years later, following another episode, Teresi was diagnosed with AFib. Fighting a hopeless feeling after atrial fibrillation, the hardest thing when you're in the midst of a diagnosis is that you don't know what's going to happen, he says. You start thinking that this fear will be your life forever, and you start to disengage. But there's a lot that can be done. You can either let that hopeless feeling rule you, or you can have hope and fight it. Depression and anxiety can mean a lower quality of life for some people living with atrial fibrillation, according to a study published in the January-February 2015 issue of the Journal of Cardiovascular Nursing. Researchers recruited 150 patients with AFib and found that anxiety was the strongest predictor of poor quality of life. They also found that more women than men reported a decreased quality of life with AFib. When it comes to treatment, the first priority is a stroke prevention strategy which, depending on the patient's other risk factors, may just be aspirin or more potent blood thinners, says Dr. Burkhart. Second is making sure the heart rate is controlled. If it's very rapid for weeks, it can damage heart muscle. From drug treatment to ablation surgery, Teresi's initial atrial fibrillation treatment was with antiarrhythmic drugs to try and restore a normal heart rhythm. These drugs are only effective about 50% of the time and can cause side effects that are difficult to tolerate, including nausea, according to Marcy Berger, MD, Associate Professor and Director of Electrophysiology in the Division of Cardiology at Froedtert Hospital and the Medical College of Wisconsin in Milwaukee. Fearing more serious potential side effects, such as liver and lung problems, Teresi explored other atrial fibrillation treatment options. In 2005, he had an ablation, a procedure that prevents irregular electrical impulses being sent from the heart's upper chambers to the lower chambers. Ablations are typically successful in younger patients who have otherwise healthy hearts. But most people with AFib, whether their heart rhythms are converted back to normal or not, will still be dealing with quality of life issues, says Dr. Wolf. 3 years later, after experiencing weird heart palpitations, Teresi underwent a second ablation procedure. Now living in Atlanta with his wife and 4 kids, he has been mostly symptom-free since. Related, panic attack or atrial fibrillation? Here's how to tell, but the fear associated with Teresi's AFib is still there, And it's felt by his family, too. A study published in August 2016 in the Journal of Family Nursing found that emotional distress associated with AFib is shared by people with the condition, as well as their partners. The fact that you can't predict it is hard to live with, Teresi says. We could all die from anything, but AFib is scarier than having a bad knee all the time. And it's scary for the people around you, too. Teresi now counsels fellow patients, many of whom are newly diagnosed with atrial fibrillation and living with the anxiety he knows all too well. In the end, you have to come to terms with AFib, Teresi says. You have to recognize that you're always going to live with the threat, and decide if it's going to dictate the way you live your life, or the other way around.